We refer to it as the express lift because of the relatively quick recovery. So most people are looking quite good within a week, which is when we take stitches out. It is a full facelift. In most cases, we can use a short incision, frequently called a minimum incision. And some people get confused because they think, oh, this must be a mini facelift. It is not a mini facelift. It is actually a full facelift, and it will improve everything from the bottom part of the neck all the way up to the eye area. The essence of a facelift is to suspend the fascia layer, and the fascia is a relatively tough layer of connective tissue beneath the skin. And there are some simple facelifts where they simply tighten the fascia layer, but it's very important to release an attachment that is always present between the fascia and the bone, and that's right around this part of the face. It's called the zygomatic ligament. So it's important to release that attachment from the bone so that the fascia will move a lot more. So then when you do the lift, you're actually getting a much more of an actual lift. In most cases, we can use a minimum length incision. Sometimes we have to go farther behind the ear, but the incision we will, in majority of cases, actually go in front of the ear, but also behind the trachea, which is that little bump that's kind of in front of the ear, and that will actually hide the incision. The biggest advantage is that the local anesthetic is much safer than alternatives, and also that it includes an ingredient that will constrict the small blood vessels so that we tend to get a lot less bruising. And because there's less bruising, there's less swelling, and the recovery is thus a lot faster. So that's really the origin of the term express lift. Not that the procedure itself is short, because it can take us several hours to do a procedure, but the recovery is much faster than it would be without that use of local anesthetic. Yes, patients, sometimes they think, oh, it's local anesthetic, I'm going to be wide awake. We actually do give them a sedative, so people are actually sleeping during the process. And we have them also on a comfortable pad. It's like a Tempur-Pedic type mattress. So people should actually be sleeping through the majority of the procedure. The results are very long lasting. I have seen many patients that I have done more than 10 years ago who still look better than they did before they had the procedure. So over time, gravity will stretch things out again, but people won't look as good 10 years later as they would say a year after the procedure. But majority of the time, you can get improvement that's going to be 10 years or more. This is an illustration from a surgical textbook chapter that I wrote recently about the express lift, and it is showing the extent of undermining, which is actually the area of the face that we're actually doing the procedure on. And you can see it does go quite a ways onto the face, so it's remarkable sometimes that we can do this with such a small incision, because the majority of the time we do use a minimum length incision.